My name is Eric Drotwa. I live in Cary, North Carolina. My story begins in 1990. I graduated from college and entered medical school at the University of Pittsburgh that year. It was in my first semester that I was talking with one of the deans of the school, who was actually a doctor himself. He said that he noticed something odd looking in my eye, and he asked me to go see a friend of his who was an ophthalmologist. Well, I went, and I was diagnosed with a slowly progressing form of uveitis. Being a medical student, I was able to get the best care that was available. I even went to the National Institutes of Health in Maryland to be seen by a group of experts, but none of the procedures that we tried worked at all. The disease continued progressing. Eventually, after a period of a couple of years, in the middle of my second year of medical school there in Pittsburgh, my condition became so bad that I wasn't able to read anymore, and I had to drop out of medical school. It was then that I discovered the first thing that a lot of people with chronic illnesses discover, which is that when you become sick, you lose your health care insurance. My insurance was through the university, the same way that most people have their insurance through their jobs. So if you become too ill to work, or too ill in my case to continue school, you also lose your health insurance. Even though I tried getting a couple of part-time jobs, I wasn't able to make enough money to continue to live on my own, and I was forced to move back in with my parents in a small town in northern Ohio. My financial problems continued because I wasn't able to get work because I was ill, and in order to continue to have access to health care, I was forced into bankruptcy again, which many people with chronic illnesses are forced to do. That was the only way that I could spend down and get myself on Medicaid so that I was able to continue getting insurance. It was about a year after that that my condition became so serious that I had an acute form of glaucoma and almost died, but luckily I received surgery in time at the University Hospitals of Cleveland, and unfortunately, I lost 95% of my vision. I'm now legally blind, and I have a number of other healthcare issues that are still related to the problems that I originally had with my eyes. After a couple of years of rehab, I was able to get back into shape enough to go back to school. I was able to go to law school. I've become a lawyer, and since then I have been able to be employed part of the time, and luckily I have gotten married, and I've been able to get health insurance in that way. Unfortunately, not only have I had to deal with all of the issues that come with a serious illness and a disability. That was all, a God-given event, and there was nothing that I could ever have done about that. But unfortunately, I've also had to change a lot of the decisions that most Americans normally make of their own free choice because of my illness. I have had to make changes in the way that I live my life, in where I can live, in what career paths I can take, in what education I can have, and when I can have it, in order to accommodate the choices that I need to make in order to maintain my health care. I'm very lucky, and I consider myself blessed because I've been able to deal so well with the issues that I've had, but I know so many people who have had it much rougher than me and who are unable to get employment, or who are unable to go back to school, or who are unable to get married or make other significant changes in their lives because they need to stay where they're at in order to keep getting health care. So I just beg any of you who are considering the changes that need to be made in our healthcare system to consider that you're not just dealing with the money and the dollars and cents, but that healthcare really represents the lives and the hopes and dreams of millions of Americans. Thank you.